Right. Let me, well, you know, I think today maybe I don't,
Good morning. Can everybody hear us so far?
I can hear Jessica.
good morning, Chris.
Good morning. Good morning, B. How's everybody?
How's everybody?
Fine.
Hi, Joyce.
Hi.
Good to see you again.
Well, thank you very much.
Good morning, I'm new.
Good morning, new.
I am a new person. I think I zoomed in on the, not December, maybe November meeting, and am participating.
Well, welcome. And where are you from?
Well, I live in Colorado Springs. I live in the southern part of the city, but I've lived in a lot of different places. I worked at an area agency when I lived in Spokane, Washington. I was on a board, an area agency board when I lived in Wisconsin, and also when I lived in Utah. So,
wow, you are experienced with AAAs, huh?
I am. Yes. A definite. Well, we were an ADRC as well. We were an area agency and an ADRC.
Wow.
Yep.
Well, you sound like you bring a lot to the table. Thanks for joining us.
I hope so. I've been living here in Colorado Springs for about a year and 6 or 7 months. Deciding what kind of volunteer work I wanted to do. And I think I met with, but I talked with someone over the phone, and I came to this meeting, and I also went to another meeting, but I don't know enough about the area, you know, the different counties and everything. So I thought the RIC would be a good place to start.
Well, welcome. Thank you for joining us.
Thank you.
Yes, Debbie, thank you. We appreciate that you're here, and check us out and see if the work we do is something you would be happy to work with us on.
So I don't really.
Chris.
Hello, Joycey Poo.
Max has joined us.
I see your closet. I see your closet is all organized behind you.
Yeah, it is that. Except
I'm very proud.
Except for the boxes in the floor.
Look at you sitting at your desk in your office and everything. Doesn't that feel good?
Yeah, it feels so good.
Okay, thank you.
Okay, we'll give her a minute to come on in. Oh, good. Jan's coming in. Okay,
we're going to wait just one moment. For those of you on the phone, we do have some members coming in the front door. So we're just going to wait just one more minute, let them get settled, and then we'll get started.
Okay, good morning, everyone. So happy to see everyone join us, both in the room and on Zoom. Welcome to the Area Agency on Aging Regional Advisory Council. So I'm going to call the meeting to order. And Jody, do we have a quorum?
Yes, Madam Chair, we do have a quorum today. Thank you.
Wonderful. Let's introduce ourselves. We'll start around the table. And Jody, you want to start?
Certainly. Jody Barker, Area Agency on Aging Director.
B. Babbitt, Chair of the Regional Advisory Council.
I'm Melody Dowell, Program Services and Contract Administrator.
I'm Jill Ruth, Colorado Springs.
Michelle Vaca, Community Dental Health.
Melissa, do you want to introduce other people in the room?
I can do that.
Okay, Laura.
I'm going to start by who I see first on my screen. Let's go with Jessica McMullen.
Want to say hi, Jessica?
Good morning, everyone. Jessica McMullen, Policy and Communications here at Ppacg.
All right. People are jumping around. Marilyn. Marilyn Massey. I think you're on mute.
Yes, I was. I'm not sure what the question was.
We're just doing introductions right now.
Okay, fine. I didn't hear the question. I'm Marilyn Massey. I represent seniors in Colorado Springs.
All right. Darlene.
Hello, I am the MSW intern and I'm working in the Family Caregiver Support Center at the AAA.
Derek.
Derek Wilson, Chief Strategy Officer with Silver Key.
Eric.
I'm Eric Bidwell. I'm a manager with the Department of Human Services here in El Paso County. I oversee the long-term care medical area as well as the adult protective service area.
Rosemary.
Hi, Rosemary Jaramillo, RAC committee member and also with the Alzheimer's Association.
Maria.
Hi, I'm Maria Cordova. I'm with the Independence Center. I'm one of the outreach coordinators. We help people with disabilities in El Paso, Teller, Park, Lincoln, Cheyenne, and Kit Carson.
Cynthia.
Hi, I'm Cynthia with the PROS program of Colorado, one of your providers.
Great. Joyce. You're on mute.
there. Good morning. This is Joyce Whittle. I'm a RAC representative for the Park County area.
Great. And we have a new member on the call.
No visitor.
A visitor. My bad. Debbie.
How do I
We can hear you now, Debbie.
Okay, I don't know how I share my screen, but yes, I hope to become a member. I moved to Colorado Springs about a year and maybe 7 months ago at the beginning of the pandemic. And I hope I sat in on the November meeting. I'll sit in today. I don't know if I need to be appointed, but as I mentioned before, I worked at an area agency many years ago. I monitored contracts and did contracts for all of our AAA services, and then I've been on committees as well. So I was looking for some volunteer work to do, and talked with Melissa Martz, and she suggested that this might be a good option for me.
Well, welcome to our meeting today, and we'll give you more information about the process for becoming a member.
Great.
Thank you.
Thank you.
Chris.
Hello, everyone. I'm the Park County representative for the Regional Advisory Committee.
Jen.
Good morning. I'm Jen Nimmo with Colorado Community Health Alliance, the Medicaid program for Region 7. I'm a RAC member and part of the Strategic Review Subcommittee.
Bill.
Bill Bowles from Southern Park County.
Thanks, Bill. Kathy.
Kathy Lauer, Executive Director, Teller Senior Coalition.
All right, and Erica.
Good morning, Erica Carter, Silver Key Senior Services, Director of Community-Based Services.
Great, I think we have everybody. So I'll turn it back over to you, B.
Thank you. Did we miss anybody that's online on Zoom? No? Okay, and we have a couple more people in the room. Melissa?
So here, I'm Melissa here taking notes for the meeting. And behind me is Gretchen, who is with our direct services team.
Wonderful. So we have a large group that are here today, and I'm very happy to see all of you, even though that storm is coming in. I guess a lot of people are with us on Zoom today, which is great, plus all the people that are in the room here. Appreciate your attendance. Our first item is approval of our agenda and minutes. First, in terms of the agenda, I just want to just change one word on the agenda. It says in action item 4, it says appoint the chair, but the chair and vice chair and second vice chair are elected, so that we will have a vote in just a few minutes. Are there any other changes to the agenda from members? Just a note for visitors that in the business portion of our meeting, it's the members that who participate in that. Okay, so I'm hearing none on the agenda. How about the minutes? Are there any additions or corrections to the minutes from our last meeting in December? Hearing none, may I have a motion to approve the agenda and minutes?
Bill Bowles, I move we approve them.
Thank you.
Marilyn Massey, I vote to second.
Okay, so we've had a motion to approve and the second to approve the agenda and minutes. All in favor, say aye or raise your hand on the Zoom.
Aye.
Aye.
Thank you. Those opposed? Seeing and hearing none, the agenda and minutes are approved. Moving on to public comments, we have Jessica McMullen is going to give us a legislative update.
Good morning, everyone. Thank you so much for this opportunity. So I just wanted to give you all a quick legislative update for what's happening a little bit at the Capitol and what your Ppacg Board of Directors Legislative Committee has been doing. So the second regular session convened on January 12th of 2022, and they have been dropping bills rapidly. As of the 24th, actually, 234 bills had already been proposed. So things are going really rapidly. How Ppacg's legislative process works is, as bills are dropped, our state lobbyist and I review all of those bills and pin them down to the ones that relate to Ppacg's programs and legislative themes. And then we bring them to our legislative committee so that they can review them and determine, is it a Ppacg issue? And then they determine whether we want to support, oppose, or monitor the bill. We did our first meeting of the full legislative session just this past Monday, and we reviewed 10 different bills. And I wanted to bring one of them up and make sure that the RAC all knew about it. And that's House Bill 22-1035, which is the Modernization of the Older Coloradans Act. And this bill is going to update the Older Coloradans Act with a variety of different ways and things. And I know Jody can give you more details on what it does. But the Ppacg Board of Directors is supporting this bill. We want to, one of our major themes is to protect and enhance services for seniors in the region. So, does anyone have any questions about the legislative session or how Ppacg does it? Our goal really is to help make sure that you guys are informed of what's happening and know how Ppacg is moving on legislative processes.
Jessica, what's the name of the bill? This is Chris with Park County. What was the number? I missed the number.
The number is House Bill 22-1035.
Thank you.
And I'll put the link to the bill summary in the chat, just because it's an interesting one. But
thank you.
It's got a lot of different aspects to it.
I was just going to ask in general, Jessica, how do we take a look at those bills in case we're not up on that?
So we have an regularly updated legislative tracking site where you can look at every bill that's happening that Ppacg has taken a position on. I'm going to put that in the chat as well. And what that's going to show is every bill that either the lobbyists and I have tagged for the legislative committee to look at, and every bill we've taken a position on. And that will also tell you where they are in the process, who the sponsors are, a summary of the bill. It's going to provide a lot of great information. It's Capitol Watch. So,
and can you sort of tell us what's new in the Older Colorado Act?
So this bill updates include reorganizing the Commission on Aging to increase the membership to 19 people in order to coordinate and implement the SAPCA plan, appointing a State Department of Human Services liaison to act as the primary contact for the commission, convening a technical advisory committee to direct implementation of the plan and recommendations, and creating the Lifelong Colorado Initiative to coordinate those strategies and implementation of the plan with the commission, committee, and key state agencies. So it's really, really going to help make sure that all of those great SAPCA recommendations that have been made and started and that we're worked so hard on are really completed.
And if I may be, for those of you who are concerned what this might mean for Older Americans Act and Older Coloradans Act programs that we administer, there really isn't a direct bearing on either the programs or the funding. That question has come up, as you might imagine. And so this is primarily, as Jessica pointed out, a reorganization of the original Commission on Aging, which for all intents and purposes is like the RAC to the AAA. The commission is the advisory committee to the State Unit on Aging and the Colorado Department of Human Services adults and aging programs. And so ultimately those that advice works its way up through the appropriate channels to the governor's office. So.
Are there any other questions by members? Well, thank you, Jessica. We'll keep an eye on the work that you're doing. That sounds like with all the bills that are proposed, it sounds like you're going to be very busy.
Well, and I'll be popping in all of the RAC meetings during the legislative session. So between now and May, just to give you guys a quick update every month so you know what's going on.
Wonderful. We appreciate that. Okay, we move on to our action items. Rosemary, are you presenting our slate of candidates?
I am. So, and I don't have the correct wording for this, so please forgive me, but I would like to recommend our chair, B. Babbitt, to continue as the chair. And I also would like to recommend our vice chair, Chris Larson, continues as the vice chair.
And our second vice chair would be also Bill Bowles, is that correct?
Oh, I'm sorry, I didn't have that, but yes, second vice chair, Bill Bowles.
We have received a recommendation for our slate of officers for 2022. Basically, the presentation by Rosemary as membership is a recommendation from membership. So that would be our motion. Is there a second to the motion?
Yeah, I'll second the motion, B. This is well.
Eric has seconded the motion. Are there any other nominations from the floor? Is there any discussion? Okay, so we'll proceed with a vote then. All in favor of the slate of officers presented by our membership committee, say aye or raise your hand.
Aye. Aye.
All opposed? Hearing none, the slate of officers has been approved. Well, thank you very much to those who are willing to serve. And I look forward to another year working with you, and look forward to Chris joining the team as our first vice chair. And thank you to Bill for agreeing to continue as second vice chair.
Thank you.
And B, this is Melissa.
Yes.
I'm going to interrupt just for 1 second. When you move to our information items, we have 2 folks sharing today. And Silver Key was slated to go second, but possibly they were hoping to start at 10:30. And so I wanted to check and see if Derek would like to start right now and do his presentation, which is going to be shorter than Dr. Vaca's, and then she could actually follow. So Derek from Silver Key, would you like to go at this point, or do you want to wait until after Dr. Vaca's presentation?
I'm happy to go.
Okay.
I won't take very long, I promise.
All right, thanks. So
Great.
I'll turn it back over to B to introduce you.
Thank you.
Okay, and so Derek Wilson is here today. He's the Chief Strategy Officer at Silver Key, and he's here to share information about their home modification program. And Laura, could you put him as the main on the screen, take down the agenda?
Great. Can everybody hear me okay? Good. Okay, excellent. So thank you for being here today. I'm happy to present. I'm glad I'm doing it on Zoom. I'm one of those, I'll apologize if I start coughing. I got the crud, I got over the crud, but I've got the lingering cough. And the doc says that can take weeks to kind of get over. So if I have a coughing fit, I apologize in advance, but hopefully that won't happen. So I'm happy to share with all of you today. I was asked to talk about some really exciting news that recently we released the information about our home modification program in partnership with the Pikes Peak Region Habitat for Humanity. So we know that, and this audience in particular knows that social determinants of health begins with safe, stable, and secure housing. One of the goals at Silver Key is to help people age in place as they choose for just as long as possible. And one of the things that we can do to keep them out of some of those highest levels of care, to keep their costs down, to ensure that they can have a high quality of life and not just exist, but exist and thrive in a really helpful way, is by ensuring that they are safe in their home, that they can remain in their home because they have accessibility. And that really begins with ensuring that their home is set up for them. So we know that we have a lot of folks that come to us asking for various types of help. And we don't always have necessarily the hammers, the nails, or the construction people to make those changes to ensure that folks have things like grab bars or ramps, exterior projects to their home to make sure that their utility bills don't go astronomically high because of, wind rushing through or seals not being adequate around doors, that type of thing. So in the process, we began conversation with the Pikes Peak region Habitat for Humanity. And we approached the Myron Stratton Foundation, and they came along after we put the proposal together, and they funded us a $150,000 grant in collaboration to be able to administer our home modification rollout. Now, for those that have been familiar with Silver Key for some time, we've had various iterations of this throughout the years. We had, Jason likes to talk about the lights and locks program back in the 80s that he was a part of. And that we've done these various home modifications over the years to help with folks. But as liability increased, as costs increased, those types of things, as the skill set maybe didn't remain in-house, it kind of ebbed and flowed over the decades. So for more than 50 years, we've been serving folks in various ways. And we've said, what do we have competency in, and what do we have a lot of? Abundance of people coming to us for assistance. And what does the Habitat for Humanity have? That's their competency in this area of home modification and assistance. And we said, this is a match kind of made in heaven, if you will. And thanks to the generous support of Myron Stratton Foundation, we had the funding to be able to do it. We are still very early on. We are in the process right now of figuring out exactly how we'll administer all of that. We're working collaboratively to work out what will the criteria look like? What will the filters look like? Because there is only so much money. And these are typically expensive processes to go through to make things, ADA compliant with door handles and thresholds for exterior ramps and that type of thing. It's not as simple as, just throw something up. And so we want to make sure that that part's in there. And we want to make sure that it's administered fairly, but also that we're able to stretch those dollars as far as we can. So right now, we're going through that process of building out what do the filters look like, what will the criteria look like, how we're going to communicate that out for folks that are looking for that help. And while 150,000 may sound like a lot, it's not going to go as far as we'd like. So we see this as a start. And then we're going to hope to be able to have the community rally around to say, this is working, this helps folks remain safe, stable, and secure in their homes, which reduces their costs, keeps them out of that highest level of care. And that folks will say, we want to invest in this more as well. We want to see this continue. And so that's our hope with the partnership with Habitat for Humanity, that we're able to use this as a launching point and then build from there, that other folks will say, I want to contribute to this, I want to invest in this, so that more seniors are able to continue to live right where they are comfortable and happy to keep living for just as long as possible. That helps them keep their costs down. And it helps, most of all, their quality of life, their happiness level, their hope level rise so that they're able to age just how they want. So I don't know if you guys have some questions around that. That's kind of where we stand right now. And we're just really thrilled to be able to be in partnership with Habitat. We're so grateful for the funding that's fueling this, that needed service. And we hope that it is just the beginning of where we're going to go with this project.
Do members have any questions for Derek?
Derek?
Yes.
This is Joyce Whittle. How far do you think that will stretch as a start right now?
That's a great question.
What will it fund?
Yeah, it really depends on all the variables that we're talking about in terms of, who comes to us with what level of complexity problems. If, windows, for example, are much more expensive than grab bars, right? So we're going to have some criteria as to how far that's going to go. materials fluctuate. So somebody needing help, we hope that all the criteria piece, the vetting part of this will be activated in March. That's our hope, is that by March, we're going to be able to activate. So we don't know based on who's going to come to us with what needs and what the cost of materials at that time. We know right now that, lumber has gone way up and then gone way down, or back down. So other materials, you can't find for a season right now, and then they're back again. So it's hard to say, but I kind of preface to say it won't go as far as you might think. So it could be as few as $10,000 per person, or it could be, much higher. It could be 150 people if it's, you do the math that way. So it just depends on the project. And we're going to try to, as always, be great stewards of those dollars and stretch it just as far as we can.
I see. Thank you, Derek.
Yeah, I would add to it, we want to have maximum impact. So we don't want to do something that, a month or two later, a person's right back into bad circumstances. So we really want it to have staying power, lasting staying power, that it does increase their safety, their stability, their security. So that's going to be one of those criteria filters that we're looking at. Good question. I think I saw another question.
Derek, this is Chris from Park County. Also, a quick question for you. As one of the things that we've seen as far as extending out to Park County and as far as being able to get contractors to do the jobs, is that something you have already established before processing for the grant? Do you have set contractors? Do you have those that are willing to come out to the rules of the West?
Yeah, I would probably defer that question to our friends at Pikes Peak Habitat for Humanity, and that's why we're working with them, because they have that in their corpus, they have that in their wheelhouse. And so instead of trying to be all things, we said, what do we do best? What do they do best? And that's, to your question, that's one of the things that they do best. They have that volunteer core that's trained in this space, or the contractors and things that are willing to give of their time for that organization, because that's what they do. And so I would probably defer to them to say that we have great confidence that they have those individuals that are, licensed, bonded, insured, so that the liability isn't so much there, but they're willing to give and yet have the means to do so.
Thank you, Derek.
You're welcome.
Any other questions?
So B, this is Melissa, and yes. I am curious, Derek, what types of services are you guys looking at doing? You mentioned windows, you mentioned grab bars, thresholds, what kinds of things were you hearing about that made you guys want to do this? And so what are some of those services?
Great question as well. Number one of the reasons why we knew this need was so great is that folks coming to utilize our health and wellness services, our case management services, more and more of them were coming with various housing related needs, whether that was, I am being kicked out, my complex has been bought and I'm needing to find someplace else. I have a home and I want to stay in it, but it's been deemed unsafe, or various things were going on. And these are very costly things: rental assistance, housing navigation, all the things that go along with, affordable housing and maintaining that, base level thing. It's hard to think about if you're depressed or even, getting to a medical appointment if you don't know and have, a roof over your head that's stable and secure, right? So it starts with that. And so as those things emerged and as we began discussions, we were saying this really does go from, I say the simple, but accessibility type things like grab bars, right? All the way to, I can't leave my home or get back into it if I did leave because I don't have a ramp or a safe ramp. It can be things like roof repairs, which can be very costly, right? So windows comes up. We've had issues of trees that are growing into housings where it's actually, damaging the structure, right? So it can go from simple things like making sure they can safely, use facilities in their own home safely, all the way to making sure that that roof over their head is not leaking, or that the windows are, keeping cold air out and moisture out. And so it really runs that gamma and that spectrum. And the emergence of this came, well, it's been coming for a long time, but the expense just kept going up and going up, and the amount of availability for folks to have alternatives and to find assistance has continued to go down, whether that's labor and contractors that are economical to do it, or the supplies to do it, or inability to do it themselves, or the fact that, you know, moving became less and less of an option because either it wasn't affordable or there simply was no supply anywhere else to go. So as we began our own affordable living complex project that many of you are aware of, that we are at the start of building our own complex here on our campus of 1625 South Murray. One of the things is not everybody's going to move into, you know, these 50 units that we hope to build, right? That's going to help a lot of people, but a lot of people will be helped best by helping them remain safe. So people were coming, they were saying, we have a need, everything from the very simple that would keep them safe and allow them to stay right where they want to stay, not disrupting their lives, all the way to the more complex and more expensive.
Are there any other questions for Derek? Well, thank you so much, Derek. We appreciate the information you provided. And of course, we're always happy to have a new service out there to help our seniors. So we really appreciate it.
Thank you. And like I said, we hope to fully roll this out in March, that we'll have all the criteria listed and be looking for communications around that through our website. And we just appreciate everyone's support, whether that's just in thoughts and good vibes, all the way to, you know, directing people to us that might want to invest in our mission.
Thank you so much.
Thank you.
Okay, let's turn to Dr. Michelle Vaca. She's here from Community Dental Health. And I hear, Michelle, that this is a big anniversary this year.
Yes, it is. Really exciting. I'll have that in my slide too. So
okay, we'll let you reveal that.
Right. Okay. So go.
Can everybody see her presentation online?
And can you hear me okay? Hopefully not too loud.
No, this is Marilyn Massey. I can't see it.
I can't see it either.
That's where you have to share screen.
Yep. I got it. Are we good now?
Yes,
yes.
Thank you.
Thank you. wake us up here.
Oh, so my name's Michelle Vaca. I am founder and executive director of Community Dental Health. And I am so excited to be here finally in person again. I think it's been 2 years. And so I miss seeing your guys' faces, and I'm just excited to be here. But with that, I just feel that I really should reintroduce Community Dental Health and who we are. I'm sure there's been a lot of changes and over these past few years. And so our mission is to provide a dental home for all low income, uninsured and underinsured persons needing assistance to obtain low cost dental services. We believe oral health care is important to overall health care for sound body, mind, and spirit. And so we have, it looks like it's cut off on that slide, but so we've been taking care of our aging community since 2006. But more importantly,
very good.
It is our 10-year anniversary working together with the Area Agency on Aging. And, you know, I have grown together with you guys so much, and, you know, from the initial funding and trying to get this program going, we partnered with the Senior Center. And so that's where we would come in and set up and access our seniors, starting off that way. So to where now we, go ahead. we have 2 offices, one in Colorado Springs and one in Pueblo. We're a nonprofit organization, and where we have various grants to make dental care affordable and accessible to our community. And we provide honest, ethical care based on what truly needs to be done. So we're not production based, where unfortunately a lot of the healthcare has kind of transitioned into kind of a production focused, and we really just focus on people's true needs. So as I was saying, yeah, we have an office in Colorado Springs. Our office is located in the Senior Center complex. So kind of coming full circle, starting there in a little space in the Senior Center, and now we're in the complex. And we provide basic dental care, cleanings, exams, fillings, extractions, and denture services. And our founding program, Senior Mobile Dental, provides in-house dental care, well, mostly dental hygiene services to nursing facilities. So, oral health is finally becoming more prominent in healthcare. And as when I first started, oral health was completely separate from medical care. And as more and more information and research comes about, it really just, people are becoming aware and realizing that your oral health affects the rest of your body. Just this week, a new study was published where socially isolated adults have had an increase in tooth loss. And so that isolation, as we know, how it affects other aspects of our life, it does also affect your oral health as well. Go ahead. Kind of threw those in to just kind of keep us on our toes. So the impact that we've had in our community, we have helped with the emergency departments in the city or in the community, and especially during the pandemic. A lot of people, when they have no dental resources and they're in with a toothache or an infection, their only recourse is to go to the emergency room. And we have developed and become a resource for these emergency rooms because they're not equipped to handle any type of dental issue. And so when people do go to the emergency room, all they're able to receive in care is prescriptions. So maybe an antibiotic and pain medication, which is a contributing factor to the opioid epidemic that we face. And so being prominent and taking care of our community's oral health needs, we're, hitting that ahead of the fact of before going into pain where people are needing to go to the emergency room. We also even, had a gentleman who had called the EMTs to take him to the ER because he was in so much pain from his mouth. And the EMTs were aware of our program. And during the ride to the hospital, they told them about our program. And he reached out to us and we were able to take care of him. And he's actually become a really great supporter. Every time he comes in, he gives us donations and everything because he's so appreciative of what we did for him and what we're doing for the community. So, a lot of our aging population is faced with chronic diseases, and oral health, as I said, does affect your physical health. And so being able to at least create a healthy environment, helps manage some of these chronic diseases. And we have a lot of people coming in with really high blood pressure, uncontrolled diabetes. And once we've gotten their mouth healthy, it's been easier for them to manage those conditions. Nutrition, of course, you know, a lot of people are on a soft diet because they don't have the ability to chew. And so as we've gained their oral health, we've been able to gain their nutritional health as well. And then sociological, you know, that's a lot of feedback that we get. A lot of people are embarrassed of their mouth or their breath, and kind of also is a factor in, you know, isolation and stuff, and being around their family. And so they are just so excited and happy once we have their mouth taken care of and healthy and have given their smile back. So with our funds, we are exactly halfway through our fiscal year with our funding, and we've used 68% of our funds already. And it just shows the impact and the need that your guys' support has really made in our community. We've never struggled to use up all the funds that we receive. And with our grants, whether it's this grant or some of our other grants, other providers have not been able to use their funding. And we always scoop up if there's any excess carryover funding. We're always with our hands up in the air, me. So and we do this economically. We're very conservative with the money that we use and the procedures we provide. So yeah, you could use, you know, a whole bunch of money on a very few amount of people by doing high-end procedures. You know, our focus is providing what needs to be done with, you know, using the least amount of money and having the greatest effect. So with that, most of our funding has been towards the denture side of our funds rather than the dental, you know, and that's the unfortunate part of that. The reason why our denture services are so high is that by the time they come and find us, a lot of times they're in such advanced disease and neglect that they're ending up losing teeth. And so we're having to provide dentures or partial dentures. So we've diversified our funding support, you know, for our stability. And so we have our senior dental grant has been our greatest source of funds. And then Medicaid is the second, and then your guys' support is our third largest. And what's concerning about Medicaid is that a lot of people received the Public Health Emergency Fund, to where a lot of people automatically qualified for Medicaid. And coming in April, that emergency funds will be going away. So we think, you know, we're preparing ourselves that we'll be having a harder hit on our other funding sources with that loss of the Medicaid dental benefit. The other thing is that has happened this year is on the insurance side, Medicare has finally included dental in their benefits. And so that's been something that we were really fighting for and promoting for a long time. The only thing is that there's so many different dental plans with that that a lot of people are confused with what their dental benefit is. And unfortunately, there, it's kind of both ways. A lot of them just barely give any kind of dental support. Like they may get one filling or one extraction for the whole year. And that's, you know, from what the need is, that's has no way of even touching any kind of oral health provision.
You're talking about Medicare Advantage plans?
Yeah, well, there's all kinds of, yeah, whether it's Advantage but all the Medicare has a different type of supplemental dental benefit. And
Medicare itself is still not supporting dental care. I mean, they've been trying to get that added for a long time, right?
Well, no, this year there's benefits with that. So I'm pretty sure everybody got some form of dental coverage. But it varies. So if it's, they can pay more and have a better plan, or I think if they don't really pay anything, then
so it's the traditional Medicare does not have a dental benefit. It is a supplement that you pay in addition to your traditional Medicare benefit. Medicare Advantage plans will have a dental benefit, but traditional straight Medicare does not.
Right. That's what I was asking.
Uh-huh. Okay, so I don't do the billing side of things. I'm the program lady.
That's okay. We love you. We love you just as much.
But because all I hear from the billing side is the so many various plans, and so many of them do not really cover the true need, the overall dental need. And so one of the big things though was, if anybody had any dental benefit, they would be disqualified out of our other funding sources, and especially our state grant. And so we were instrumental in talking with the state, that assuring them that we would use whatever benefit Medicare provided first, and then supplement the rest of their oral health needs with the grants that we had. So that was a big thing, a big problem, and a big scare for us, because I'd say 80% of our patients then had this Medicare benefit, at which then would have kicked them out of the main funding support that we had. So that's kind of that on our support side. You know, it's just so awesome to be able to take care of our community, and the sheer appreciation that we receive from all of our patients. And that's kind of a draw to the providers that we have working with us, is, you know, they really feel the sincere appreciation, and realize that they are making an impact. So, you know, with our providers, that was one of our struggles that we had this past year, was just like every other business, we struggled with staffing as well. And one of our biggest struggles was our dentist. We had lost our main full-time dentist, and, you know, due to COVID complications and long-term stuff, you know, but it pretty much lasted the whole year of trying to find another good quality dentist to come and take care of our patients. So, you know, one of my big quotes that I've always lived by was, all change is scary, but it's the only route to growth. And with some of the new dentists that we have joining us, we have been able to expand some of the services. So we've never really offered or provided crowns because most people can't afford that. But between our new dentist and finding a lab, we've made crowns very affordable. So, you know, especially if we're needing a tooth to support a partial, you know, with that crown, that makes all the difference. And then the other thing that's super exciting is our dentist also is very proficient in implants. And the only implant that we would offer is only for people who have lower dentures where they don't fit anymore because there's no bone ridge to hold lower dentures in. And so we are going to this year expand that with our new dentist and provide implants that will help hold those dentures in at a severe fraction of the cost. But we're not going to put that out there. It's only, we don't want to be an implant center. So, you know, that's just for our people, our patients that we come across who really need help to make their dentures functional. So. So does anybody have any questions?
I have a question. You said you've used 68% of your budget this fiscal year. What is your fiscal year?
It ends June 30th.
So you're more than 6 months in.
Yes. Yeah.
Okay, great. That makes a lot more sense.
Okay.
Other questions?
All right. Thanks, everybody.
It looks like there's a question in the chat.
Yes. What is it? I can't see the chat, Laura.
It says, are you able to offer help to patients who have a dental plan, not Medicare, that do not get the help they need?
Yes. Yeah, most we've been able to figure out various dental plans, and we'll use that benefit up first. And if they have high copays, then we can use our funding to help them with the copays of their dental plan so that they can still utilize. So yeah, I would say yes, but then I'm not my billing people.
I was interested in your statistic that you lowering ER visits. I guess I had never really thought about the fact that if you have severe pain, you know, in your mouth, where do you go? And yeah, ER would be where you would go, oftentimes go, isn't it?
Yeah. And it's sad, and it was scary, especially during that pandemic. When things first locked down, we had a patient who had come to us, or they had gone to one of the commercial dental places, and they didn't really treat what her problem was, and so then she ended up having a real huge problem. And from the ER, she reached out to us, and I was able to call our oral surgeon to come in, and just him and I were there, and we took care of her. And you know, it just was scary for people to think that people would go to the ER when that pandemic was at the highest, you know, and potentially expose themselves just, you know, because of oral pain.
There's another question in the chat from Darlene. The question is, are services for seniors only?
No, our target population are seniors, but we take care of all adults. We don't really open up to children because there's enough children programs in the community, but there's not very many adult and aging programs. But my grants, the biggest grants that I have is for those 60 and older.
Well, thank you so much, Dr. Ppacg. It's been, I think you were very early on in your program when I first came to AAA. And so it's just been exciting to watch your program grow and watch you meet the needs of the community. And
yeah,
we're so happy that we're able to provide some of your funding.
Yes, you guys have been instrumental in our growth. So thank you.
You have room for another question?
Sure, Joyce.
Thank you very much. This is Joyce Whittle. Do you have I don't know if you had it in the past or not. I thought I had heard that you had mobile services, or is that just x-rays?
No, we do. We have mobile services where we go into nursing facilities.
Oh,
and
that's right.
Yeah, or even rural communities. But what's happened over the years is that we were the only provider to go into nursing facilities. But when Medicaid adult dental benefits came about, more dental providers then became interested in going into facilities. And so we've kind of scaled back and forth, as long as their needs are being met and it's being met ethically, then we'll let those other providers, continue taking care of the residents.
Okay, but you don't have actual mobile services out into the community, just nursing homes?
Yeah, just nursing homes. Now that we have our own office established, then that's our, the community.
Okay, thank you, Laura.
Okay, thank you so much. Really appreciated that update. And
hey, Pete, Mary has her hand raised.
Okay, Mary. Mary Kep, did you have a question? You have to unmute your microphone.
Okay, my question is, if you are offering services to adults who do not qualify as senior adults, does the funding come from a different place, or is it the funding pocket that's provided to you by the RAC?
Oh, no. Yeah. So the funding for the RAC is 60 and older. So, and, also within El Paso, Teller, and Park County. So anybody under 60, we have a different funding stream. And so keep your fingers crossed. I just turned in an application to hit those people that we call, they're in the Medicaid gap. So they make just enough money to disqualify them for Medicaid benefits, but don't have the financial means to pursue their dental needs.
Thank you.
Okay, thank you, Mary. Okay, we're going to move on then. We have had some very, very nice presentations today. Membership committee. Rosemary, did you have any other information from the membership committee?
Hi there. We actually don't have any updates, but we would like to gather some names of people who are interested and start on that process, but we do not have any other updates right now.
Okay. I did receive an email from Elaine McKenzie, who was working with Marilyn Bradish on the Adopt a Senior program. And she wanted to report that at Christmas, we were able to give a gift, to gift an individual in one of the senior communities with a nightgown and slippers and blanket. And she lived in a nursing facility and only asked for pajamas, but they included a couple extra items as well. So we're happy that they were able to provide that. In addition, unfortunately, Elaine says she's going to have to resign from the RAC. She has taken a full-time position that obviously meets during the day and will make it impossible for her to attend our meetings. But she talks about enjoying her time here on the RAC, and I really appreciate her service, in particular in starting the Adopt a Senior program. So I just wanted everybody to know about that.
I wonder if I could add something to that.
Mary, sure.
Yeah, I worked with Elaine at Christmas time as we were doing this program. And we not only gave to the one lady in the nursing home, there were two other ladies, one lady and one gentleman that received. So there was $100 total, and we gave it to 3 different people.
Okay.
Gifts for 3 different people.
Right, I didn't have those details. Thank you, Mary, for filling us in.
Yeah, I didn't have those details either. So yes, thank you. And just some food for thought. This past year, one of our facilities actually had their clients sign up on Amazon. And then I just went into Amazon and clicked the button and sent them something. So we might want to keep that in mind because it was kind of a difficult task trying to find people. You wouldn't think it would be, but it was. So we might want to keep that in mind for next year.
Sure.
I have to agree with that. We did search. We kind of scraped around looking for someone who actually knew someone who would say, yes, I would appreciate that. People are reluctant to say, yes, that would be so wonderful if you could give me a gift. They're just reluctant to do it.
Yes.
Right. Well, thanks for participating in that and making that happen. I appreciate it.
Yeah, Rosemary, Mary, and then Elaine, thank you for all your help, all you've done.
Strategic Review Subcommittee. Jen, is there any report there?
Yeah, we will be having our February meeting on the 10th at 10 a.m. So watch your inbox for an invite on that. What we'll be doing at that meeting is reviewing our focus areas for alignment to the next strategy plans and sessions that are coming up. So if you would like to join that subcommittee, we'd love to have you join us. We're also working with the Commission on Aging meetings to make sure that all of our programs are working in concert together. So just kind of reviewing all the different projects going along and making sure that everybody is working well together and that projects are doing, you know, pretty much the same things and creating the same goals.
Jen, do you anticipate that will be a Zoom meeting?
Yes, I do anticipate that to be a Zoom meeting.
Okay. All right. Jody, we'd love to hear your director's report.
You know, I'll jump to the podium. I'll walk slowly. Well, good morning, everyone. Is that better? Can you see me okay? Okay. We'll let that refresh. There I am. Yay. All right. Good morning, everyone. Thank you so much to the members that are here in person, the members that are here by Zoom, our guests, and of course our providers who are here. So I have quite a bit of information to share. As you know, we really don't have a quiet time within the Area Agency on Aging. It just looks different month to month and quarter to quarter. So I thought I'd bring you up to date where we are on so many projects and some of our regular efforts. I do want to make a quick note, though, that when we talked about the House Bill 1035 and discussion around the modernization of the Older Coloradans Act, which does include the Commission on Aging. That is the Colorado Commission on Aging. That is the statewide commission. The commission that B just mentioned a moment ago is our Pikes Peak Commission on Aging, which, as you know, transferred from the city-based organization to a regional-based organization under the Area Agency on Aging. So just want to clarify that information, and they meet with us here the third Wednesday of the month in the afternoon. So if you, as a RAC member, are ever interested or available, you'd like to join that meeting, we would love to have you. So I'm just going to dive right in. We'll talk about funding first. We have released the NOFA, that's the Notice of Funding Availability, and open the RFP for our next state fiscal year, which is services June 30th of 22 through July 1st of 22 to June 30th of 23. And so that request for proposals just went live on Monday evening, and it's already ready there for our providers to begin their application processes. We are blending that this year somewhat in including some of our transportation dollars that comes through Laura Cruz's mobility coordination programs. And so the voice that you're hearing is actually Laura helping us out with our tech needs today. And so she and Melissa are working on that behind the scenes. So thank you. But our providers will see a little bit different system, which will include some transportation funding available outside of our traditional OAA funding. And so from our standpoint, as well as working with our providers, it's just another way that we can create some efficiencies in application and usage and review, and ultimately distribution through the 3-county area. So providers, if you haven't seen that yet, don't be alarmed. It's there on purpose. Just make sure you read Melody's emails, because it does reference that. So as you know, the TRS met around carryover funds and provided recommendations to the RAC in the, I believe it was in the December meeting. And then those recommendations were provided to the board of directors in the January meeting, and those did pass. And so for providers, for those of you who are waiting on the carryover funds, we did also receive the carryover option letter. And so everything's in process right now to get those contracts amended with your, yes, Dr. Vaca is in here going, phew. Yes, she's been sweating that at 68%. So, but anyway, the contract amendments are in process, and we will get those out to you who requested that just as soon as we can. I would like to also point out that there are additional carryover funds available beyond the initial 8 requests. And so even if you requested carryover funds and you know that you may be able to use more, I would encourage you to send me an email with that request as soon as possible. We are going to be going through the process that the TRS recommended and was approved by the board of directors, which ultimately allows us to access and access that funding and move it through the process quickly without having to go through additional steps, which is simply that providers will send those requests to me by the 10th of the month. We will broadcast that request throughout to the TRS committee. We will quickly review and confirm and get those into the approval process internally. So thank you very much to TRS members who were instrumental in making those recommendations, reviewing the requests, and ultimately creating this contingency plan, which allows us ultimately to move through far more efficiently. So thank you very much.
What does TRS stand for?
Yes, yeah, sure. That is the Technical Review Subcommittee. TRS reviews all of the funding requests, both at the traditional annual RFP process as well as carryover. We also, I had mentioned some time ago that we were expecting to receive a couple of small funds related to vaccine education and transportation. Those have now been received. A portion of that will go into a statewide educational program. And then the rest will be focused internally within our three county region. And so be watching for more information about that as we get started with that. Our ARPA funds, for those of you who are not aware, ARPA stands for sorry, we're having a little technical difficulty back here. Help me with ARPA. Yes, thank you. It stands for American Rescue Plan Act. That was a federal fund program. And the Older Americans Act funded services have received a specific amount just for older adult services. And so you're through the news and other sources, you're hearing about the ARPA funds, or American Rescue Plan Act funds. This is a specific carve out just for Older Americans Act services. It will have, because it was just received, and we have actually received it now. We just signed contract to receive those earlier this week. We will be in discussion and coordination across the three-county region with all of our providers as to how best to access and use those funds to meet the maximum need and take opportunity for funding that is different than our traditional Older Americans Act funding. We may be able to meet some needs that we don't get to under the traditional funding sources. But also give everyone access to potential use of those funds. So more to come while we figure this out. Again, we all seem to feel it and hear it every day. Nothing is normal right now. Some of these additional funds coming into us have never been seen before. Not just the amounts, but the expected usage. How a AAA may access the funds, or what the intended use is for the funds. And so we're literally learning as we go, as we receive the scope of work with the different funding sources. So be watching for more information on that. As always, we will, we'd like to include RAC members, TRS members in the discussion, as well as we start these coordination conversations with our providers. So be watching for that. The beauty of the ARPA funds, though, one thing that's a little different than some of the other emergency funds that we've been appointed, is that we actually have nearly 2.5 years to allocate this funding source. And so this package won't expire until September 30th of 2024. Okay, so just a little less than 2.5 years.
Tony, can I interrupt for a question?
Yes, Chris.
As far as being provider funding with additional funding with the rescue plan and the specific fund that's gone to the Older Americans Act portion, Can that be utilized for senior organizations that are not a direct provider? As you know, we only have the one provider for Park County. We've got some interest now there's 2 studies actively for transportation, and with it be inclusive of vaccines and transportation, can that be broadened out to other organizations outside of providership?
So we're still checking into that. That's a valid question, and it's certainly something that we've been talking with as a planning committee here at my office. My team, actually, all 4 of us are here in the room. That when you hear me talking about our planning team, that's myself, Melody Dowell, our contracts administrator, Melissa Martz, our programs administrator, and Laura Cruz, our mobility coordinator. So we actually meet regularly, and as we've known that these funds were coming in, we've been talking about how best to use these for the greater good, not just immediate services, which is always important, but we can always access program dollars. These are dollars that are specifically intended for infrastructure and capital growth. And so that will be the primary lens that we'll be looking through with our current providers. Sometimes it's easiest to go with our current providers because we already have a contract in place, right? So what we need to look at is what is best for the larger region, and we'll go from there. So, like I said, we just received the scope of work earlier in January, and so started talking about that and received the actual contract. The contract was signed and distributed to us earlier this week. So crazy early in the process, but that's why we want to make sure that providers are aware that they'll be receiving an invite to start talking about coordination and projects and plans, and our RAC and TRS members specifically will be invited to those as well for input from the community standpoint. So thank you, Chris. Okay. Absolutely. So more to come on the ARPA funds. We do have a couple of changes within our staff. We're still have a hiring position open for an ombudsman. As you might imagine, working in long-term care community and accessing long-term care communities is very difficult right now through the pandemic. This opening has been quite a few months now, and so we're receiving a new batch of applicants, and hope to start that interview process very soon. So if you know of anyone in the community who has background in aging services, in particular advocacy, doesn't even mean necessarily advocacy for aging. It could be advocacy for children or those who are disabled. It really it is different than our protective services, and so that's a distinction that Eric and I like to try to make in our conversations. But ultimately, the ombudsman is someone who is advocating for and being the voice of the senior, and sometimes that can be challenging if there's a concern around what those requests might look like. So it's completely different, and takes an extra special person. And we're very privileged here at the AAA to have 2 of those fantastic people running the program now. But we have 105 long-term care communities in our region, and we only have 2 staff members who are running those programs. So be aware too that we are also looking into the possibility of creating some volunteer positions within the ombudsman program as well to help provide support to our staff. So if you know of anyone, they can go right to our website, and all the application information is there as well. We are going to be losing 2 longtime staff members, which is, I think this is the first time I've had to say it out loud. It's all been by email so far. But Karen Morgan is one of our case managers and SHIP counselors. She will be leaving us mid-March. And so she will be truly missed. She's made the rural clients her priority in her time with us. She actually started with us as a volunteer and then became a full-time staff member a little over 7 years ago. So she will certainly be missed. And then our direct services supervisor, Gretchen Bricker, who is the team lead for our case managers and SHIP counselors, excuse me, will also be leaving us. She'll be retiring in April. And so April 8th will be her last day with us. And so while we get things sorted out here and plans, those openings will also be posted to our website. And as always, I'll be sharing that with you as well. So if you should encounter either Gretchen or Karen or have availability to pop them a note, please just thank them for their service. It's interesting because in this environment within a AAA, you know, this is our job. This is what we signed up for. But there's so many times when we have opportunity to reach a community in different ways that aren't necessarily in our job description. And I see that both to the community and within staff of both Gretchen and Karen. And so they will certainly be missed, and it'll take us a while to train the new people to do that as well. But do please give them your thanks if you have opportunity to do so. As you know, Caregiver Pampering Day through our Family Caregiver Support Center is an annual event. And COVID has changed what that has needed to look like over the last year or two. This year will be May 5th, and it will be an all virtual program. We're just finding too many circumstances where we can't make specific plans for an internal program. And so Kent Matthews and his volunteers and the staff here have already switched what that might look like, going to a full virtual programming for that day. However, there will still be some specialized programs as well as some follow-up programs that we will post to our website after Caregiver Pampering Day that will be some trainings and presentations that will be made available to the public. So as we know more and have direct access for that, we will certainly share that. The Yellow Book. Those of you who have a yellow book on your desk, it still says 2020 because it just did not make sense for, oh, thank you, Cynthia, I see you holding yours up. Thank you. So of course, from a financial standpoint and just distribution standpoint, it really made no sense to print a fresh copy last year. So many of the places, even when we received the 2020 book in May of 2020, did not have the capacity to even receive the books. They wouldn't let us in the hospital. They wouldn't let us onto Fort Carson. They would not let us, the libraries were closed, which is a huge distribution site. And so our staff, I just want to highlight Melissa Martz in particular, who took on the role of distribution queen to get those yellow books out to the community. And we also had a variety of volunteers from the RAC. I know B was one of those here, who when we would receive requests for the yellow book, our volunteers would take those out to individuals or to groups. And so we've made it work. It's not very pretty, but we made it work to get that information out to the community. And those of you who may not be aware, the Yellow Book is our senior resources guide, and it is yellow. And so therefore it's just simply called the Yellow Book. But it's a full directory of or a directory full of services across the 3-county region, not just the ones that we fund, but truly more than that. We will be printing this spring. We're looking at that now, what that's going to look like, how we can best make that work. The economy right now with just printing supplies and goods is very challenging. It's going to be far more expensive than it has been in the past. So our printing quantity may not be quite as many as in the past, but it'll make sense for the circumstances that we're in. So we want to be judicious with that, but be watching for that. We'll probably have those delivered to us April or May as we get that sorted out. Well, next week we have our state assessment. So providers who are here, you have your own program assessment with us. Well, we as the AAA have a program assessment with the State Unit on Aging. And so they will be with us next week. We'll be out in the community. We'll be here in the office, and we'll report out how that goes. But I expect we'll be right on target with all the points we need to be. We've done a lot of new and creative things during the time of COVID. So we're really excited about that, how that's working out. So at this time, that's all I have for my immediate reports. If there's anything, any questions that I might answer, otherwise I will hand it back to our chairperson.
Do we have any questions? Okay, thank you, Jody. Appreciate it very much. Lots of information to consider. Okay, in terms of my report, I'm going to keep it short because I want to give us time for our discussion. I just wanted to mention we had our outreach meeting on Monday, and I was excited to congratulate one of our former members, Cynthia Key, regarding the development of the American Heritage Center that's being built, or fundraising and being built at what was known as the chapter house for the PEO organization, which is a philanthropic educational organization that raises funds for women's scholarships. Anyway, this property is on the west side, and it will be a fantastic development area, and we're happy to be working with Cynthia on Melissa, did you have any information you want to share on that cultural food project?
Sure. And so then in addition to that, Cynthia and the outreach committee had also submitted a proposal to the Women's Community Leadership Initiative through Leadership Pikes Peak to do culturally appropriate food boxes to older adults. And that's a effort that the group has been speaking about for quite a while. And so we put together a proposal to see if that group of individuals might want to work with us on that proposal or on that work. And so Cynthia and I have been asked to present to the Women's Community Leadership Initiative next Thursday, I believe it is, February 2nd or so, about the proposal and project. And hopefully we will be one of the projects that the group selects to work with us on that. And so that'll be something you'll continue to hear more about here at the RAC, because we have a couple of RAC members who sit on that outreach committee. So that's Joe Ruth and Rosemary Jaramillo, and of course B, and then past RAC member Cynthia. So that's really good news, and hopefully we'll get selected. But if not, we will continue to forge ahead with our group and continue to reach out to RAC members when the time comes to help as well. So thanks, B.
Sure. Well, like I say, I wanted to keep my comments short today so we can move into our discussion items. As you know, February is Black History Month, and so we wanted to have a discussion related to that. And I believe is Jennifer on?
She was not able to join us. She did email me a little bit ago, and she has some work that she's finishing up for one of her fellowships, which we were hoping to hear about today as part of this, but she's actually got to finish that up. So she was not able to join us.
And so what would be next then?
So possibly, I know Jen had mentioned that her organization, CCHA, has been doing quite a bit of work around diversity, equity, and inclusion. And she was going to share some insights that she had received from some of the different trainings that she had done. And then we have some other things to comment on after that.
So
Jen?
I just had a graphic I wanted to share with the team. So if I were able to share my screen.
You should be able to, Jen.
All right, thank you. Let's see here, screen share. Everyone should be able to see that. Able to see the screen?
Yes, yes, we
Okay.
can see that, Jen.
So the basic principle was, and this was something that was a big takeaway for me in our diversity, equity, and inclusion training, is equality versus equity. And something that that I think was important for us to all think about is that sometimes we often think about equality and giving people tools to help make their lives better. And it was really interesting, Melissa, and I'm so excited to hear more about these culturally appropriate food boxes and how we have worked so hard to make sure that people have stable food and food options for people who have food insecurities, but we've not quite considered that, are they culturally appropriate? And I think this graphic really speaks to that. We give them the same box, but they have different needs. And this graphic really kind of explains that quite clearly. So in the first screen, in this first picture, you see that these three people are quite different, but they have the same box and they're standing behind a fence to watch a baseball game. But they're all being treated equally. So they each get the same box. But if we give them different boxes, now they can see the game. And that's what equity is. However, at the third image, what we see is if we just remove the barrier, then we adjust, we get to where it's liberty, it's justice. And at the end of the day, it's really where we would want to be, is removing that barrier. But I'm really excited to hear about the progress of where that work goes for those culturally appropriate food boxes. And there's so many other opportunities where we can look at of improving our programs of where we do things, whether it's in housing or transportation, even our membership committee and how we are engaging members to join our RAC so that we do have diversity within our own groups, and making sure that everyone is represented and has a voice. So keeping those things in mind as we move forward as a RAC, I just wanted to make sure that folks just kind of put that in your brains for a little while. And if you have questions about anything and want to reach out, I'd be more than happy to visit with you. But it's been some very worthwhile training, and it seems to be a very topical subject that we've been hearing a lot about, not just within CCHA, but a lot of companies are starting to talk about it. So at any rate, I'll keep that brief so that we can move along. But thank you so much for that brief moment, and have a wonderful day.
Thanks, Jen.
And so Jason sent us over here behind the screen a little text about sharing on their diversity, equity, and inclusion initiative that they're working on. And so I'm going to turn it over to Jason for a minute.
Yeah, thank you very much. And Jen, I really appreciated the comments you just made. And I know there's a lot of efforts across the community on DEI issues. I want to share with you that Innovations in Aging and Silver Key are partnering together right now with a marketing company that specifically is creating marketing efforts to be able to link with the monolingual Spanish-speaking, bilingual Spanish-speaking populations throughout the El Paso County region to be able to create easier access to healthcare systems to include Silver Key, but not exclusive to Silver Key. So we're looking to be able to start to have different partners along this effort. The project is called La Conexión, and the idea being is that if we do intentional social marketing with different media, whether it's online or through print and through other kind of channels, that we will be able to open up access to be able to create culturally responsive organizations that know how to serve those individuals as well. And so it's a big initiative for us, newer initiative, but I'm very excited, and we'll be able to update the group as Innovations in Aging and Silver Key step through with our partnership. One of the entities that's involved, it's a public-private partnership. It's called Viva Marketing, and the three entities are coming together around this, and I'll be able to share more in the future. Thanks for the minute to share.
That's awesome, Jason. Thank you so much.
And it is kind of nice to have a moment to reflect on the different ways that we can better serve people that are not always recognized in our community and that end up kind of being hidden in our community even. So I'm grateful for that opportunity. Another piece that I wanted to have Joe Ruth share a little bit about. Joe has been able to discover some resources in our community around Black history, specifically within our library system, and also with a Black History Museum. And so I wonder if I can put Joe on the spot to comment a little bit about some of the folks that she's met through those efforts.
Thank you. There are several initiatives within the, I would like to particularly talk about the Pioneers Museum. They aren't often recognized as a moving force in our community, and I'd like to just give an extra shout out to their programs. If you have not been into their library and their various exhibits on an ongoing basis, you really will miss out on a lot of what happens with the Black history. We also have the museum on the west side. I'm not really updated as to what is happening with that museum, but there are available. There are several, the Pikes Peak Library District as well has the book. What, do you have that book available, Melissa? Invisible People of the Pikes Peak Region is the book that was written early, and the author is, I don't have that name right off the top of my head, but it has been recently in the last year or so revised extensively to offer detailed information about our Black community here from starting with the early days of 1870 and before 1860. So if you want to know something more about our history, please get a copy of that book from the Pikes Peak Library Local History section. It's an illuminating edition, and I think you would enjoy knowing more about that. Is there anything else I can add that I didn't have a list? Melissa, do you have something else?
So I'll comment on your Pioneers Museum.
Yes.
And because February is Black History Month, which is kind of why we decided we wanted to spend some time today sharing with the RAC and having a little bit of a conversation around our Black community before we launch into February, because by the time we meet at the end of February, Black History Month will be at the end. So just really wanted to plant some seeds for people to be thinking about ways to, kind of enhance your understanding and knowledge of, Black history in our region. And that book, which Joe Ruth actually introduced to me not too long ago, is amazing.
Could you repeat the title?
The Invisible People of the Pikes Peak region. And it is so much fun because there's just, you know, when you've been in Colorado Springs for a long time, which many of us have been, but some people are brand new to the region as well. You know, there's certain faces that we tend to recognize, you know, as our kind of iconic, you know, people in our community, whether it's, you know, General Palmer or, you know, Myron Stratton. And we don't often realize the impact that Black people have had in our region. And so that book is about 1.5 inches thick. And it is a really fun read with a lot of really good stories. And so I so appreciate that Joe brought that to our to my attention and to our group. And with the Pioneers Museum, they are actually hosting private tours during the month of February within their museum to kind of give you a deeper dive into some of their exhibits. So when Joe brought that up, I would just add that they're actually doing some private tours. When Joe mentioned the other museum, which is the Black History Museum, which is pretty much unknown, I think, in our region, that is located at the West Side Community Center. And so another little kind of hidden, invisible, you know, gem in our community. So something fun to check out. And so, you know, our diversity, equity, and inclusion group that meets, you know, once a month, if people want to join and participate in that, please send me an email. You are welcome to come and participate in those conversations as we try to explore other ways to get diverse faces sitting on the rack. It's really important for us to have that because that's how we can figure out and know how to better serve people in our community, both in El Paso Park and Teller counties. So keep that in mind. I'll add one more piece. Even though February is Black History Month, we are coming up on the weekend of one of the big Asian celebrations. And so this weekend and going into early next week, the Rocky Mountain Women's Film Institute is doing some Asian films. Some of them are online, and then I think it's on Monday night, they're actually doing a film at Kimball's. So a little bit of Asian cultural deeper dive there too, for people who might be interested in that.
It's Chinese New Year.
Thank you, Jody. Chinese New Year. So, and most of us, I think, just kind of take that for granted. You see all kinds of great, you know, activities happening, and then all of a sudden it's over and gone. So I think that this year with the Rocky Mountain Women's Film Institute doing the films is a really neat addition to the things that happened this year. And so I'll just be curious to hear from people at the end of the month, at the end of February, if anybody did anything fun and different for Black History Month, and if they've learned anything and have any insight as to how we can better serve people. And then from a Hispanic side of things, I will say that with the vaccine outreach, we are partnering with one of the gals here in the region who does pop-up vaccination clinics for the Latinx community. And there's going to be a mass vaccination clinic happening on March 6th at Hope Church on the southeast side of town. And so we will be there to hand out yellow books, but we are also going to help pay for transportation costs that people might need to get to that vaccination clinic. And so that's another opportunity for some outreach. And if anybody on the rack wants to attend that event with me and help hand out yellow books, you're welcome to do that. I will also be looking at having someone come who is a Spanish speaker to join me. So that's going to be really important. Yeah, so I'll turn it back over to B for a few minutes.
Right. And I just wanted to mention that we've had some outreach from the Division of Aging and Adult Services regarding the development of Colorado aging data profiles. And I was curious about exactly what that was all about. And so did a little research online about other states that had done such things, and was able to take a look at, for example, the state of Connecticut developing a report on the impact of race and ethnicity on healthy aging. So, I'll just give you one little piece of that. There were disparities in 56 chronic diseases, mental health and health services utilization indicators across those race and ethnic lines. There were only 4 indicators that did not have racial disparities. It's interesting what those were. Heart attack. It seems like we evenly distribute heart attack across the population. Liver disease, post-traumatic stress disorder, and stroke were areas where you had similar occurrences across populations. Of course, this is an entirely different state with a different population, et cetera, but it'd be interesting if Colorado developed such a program and we could learn more about ourselves, I guess, basically. So I'm looking forward to seeing whether that project, how that project develops. Well, are there any other, does anyone else want to contribute to this discussion from our members?
This is Melissa again, and I'd just like to thank Maria from the Independence Center, who actually put some links in the chat to the Colorado Springs Pioneers Museum link, as well as the link to the Pikes Peak Library District with the book. So thank you, Maria, for finding those and putting those in there. That's great.
And once again, for people who might be new to our website or this meeting, et cetera, if you can't get those all written down really fast, how can you get those up from the chat?
So I can attach the links to my, to the minutes.
Okay.
However, what I usually do during the meeting is I usually click on those and open them up right now during the meeting. And then I have it up on my, my internet search. So just take a second and click on that. It'll take you right to it.
Very good strategy.
And then you have it.
I like that strategy because I struggle with that. Write that down, pay attention to what's happening in the meeting. And very good idea. Like that a lot. Okay, calendar of events. Does anybody have an event you want to let us know about that's coming up in the next month? Okay, hearing none. Our next meeting is February 24th. At that time, we'll make sure to appoint our subcommittee chairs. And we have our executive committee meeting composed of the officers and those subcommittee chairs, our first Tuesday at 10 a.m. via Zoom. Thank you again to everyone for attending. It's just so nice to see this large attendance today. And I guess we're sort of all getting ready to move forward with new initiatives, et cetera. And that's exciting. So thank you again. I look forward to serving as your chair for the next year. And I look forward to working with each and every one of you to help provide excellent service to our seniors in this community. So thank you. Have a good day.
Thank you. I have a really quick question, if I may, before we sign off.
Sure.
Number one, thank you for electing me your new vice chair. Number two, thank you to our presenters. But then number three, I think at some point we may have discussed changing the active date for the executive committee to Wednesdays. And I didn't know if that had been tabled or if we're moving forward with that.
Why don't we talk afterwards and we can come up with a time that fits everybody, okay?
Thank you, B.
Sure.
Thank you, everyone.
Okay. All right. Thank you again. Bye now.
Thanks, B. Have a great day.
Bye-bye.
Bye-bye.